not just football gets hit, but hockey players and all that. So any of those equipment laden athletes. So I'll let them take it away.
Well, I know some of you, two guys who just left, I know. And certainly work together with many of you in a lot of different ways. And I figure if I'm going to have a heart attack, this is the place to have it. So it's a good thing. Well, my interest in this is I'm a family doc, but also certified sports medicine, and have been doing game coverage for Rice Lake for quite a few years on the field. And now we have athletic trainers, which we didn't always have, and so really a nice luxury. Some schools are now saying if you can't afford a trainer, you can't afford football because of all the stuff that's going on, and all the awareness and injuries and stuff. I don't know if the injuries are more common, but the awareness is higher, and certainly the presence of athletic trainers is reassuring and gives us, as parents and physicians and as medics, the first hand on the field to make injury assessments and start to train for care. As a doctor, and I can speak for medics, I mean for trainers too, when we see a paramedic crew come, everybody's feeling good because it's the cavalry coming to help and take over transferring these patients in. As you know, we've had a couple of transfers from football games recently, or maybe some of you may know. One was a spine board case, the other turned out to be a catastrophic head injury that wound up in neurosurgery and fire and saved the kid's life from subdural hematoma. Rare injury, really rare, but 40% fatal in football players. So pretty scary incident. I never thought I'd see one in my life, and it happened after the game in a kid who had no apparent injuries during the game. So, I mean, it just happened that we were still there. Happened that also that was one of the games without an ambulance there. But as we all said later, the ambulance probably would have left by then because it happened 5 to 10 minutes after the game was over. But as it turned out, response was great, of course, and everything was handled great. And what we wanted to do, because of these cases, kind of brought up some things we thought would be good to share and also talk about and find out protocols and how you guys approach it, and tell how it's recommended by the National Athletic Trainers Association. I think Matt might have sent around or made you aware of this document. We think it's the most recent edition of this, but it's from 2001. I don't think there's been any updates to it, but what has changed is some of the equipment. And Joe's going to be prepared to show you a couple things about that, just so everybody knows about it. This document, and I heard you mentioning the Frontline show last night. It was this amazing show. I mean, it just makes you sick to watch. But some of the people that were quoted as experts are named in this as contributing to this document. So, Dr. Cantu was featured in here. Julian Bales, who's the Pittsburgh Steelers neurosurgeon, is in here as one of the guys who helped put this together with the trainers. So it's come from a consortium of the trainers at the pro and college levels, and then physicians through all spectrum, and I'm sure there's emergency medicine people well in here too. Registry of EMTs, I see. So it's kind of a document that's they call the Inter-Association Task Force for Appropriate Care of the Spine Injured Athlete. Reading through it, I think that the thing that I take away from this, and what I've been trained in some of the sports medicine meetings I've been to, is just the difference with a football player than your average downed, injured person, especially because of the equipment, and pertinent to helmet removal is a big one. Presence of shoulder pads raises your torso, as you know, and with the helmet on, this is true now in adults and children. I saw articles that have recently been published relative to youth football. So those little squirts out there, same thing. As soon as you take their helmet off, they get into the hyperextension of the neck. So it's pretty hard to maintain inline extension or inline mobilization of the neck without the helmet and shoulder pads on. And they should, according to the standards, only be removed together in a supervised setting, which is certainly hard to do on the football field, and it can be hard to do in the ER. But I know that I used to work in the ER I wasn't a full-time doc, but I did enough shifts over 20 years to have these experiences of having those helmeted players come in, and boy, you know, it's a tricky procedure to get that off sometimes. And again, since equipment has changed, it's good for everybody to see it, have a chance to ask any questions of the trainers, and then for the trainers to know how you guys proceed and protocols and all that stuff.